My name's Dr. Heather Logan. I'm a family physician that works at Addictions and Mental Health in Fredericton. Substance use is common and has been common for thousands of years. When we start to see problematic behaviors and consequences of the use of substances, when we see people needing to use more of whatever the substance is, whether it be opioids or stimulants or alcohol, in a way that affects their productivity, their mental health, and leads to negative consequences in their lives, that's when we start to label it as a disorder. Opioids are drugs like codeine that you see in Tylenol number 3, or morphine, Percocet, Oxycontin, hydromorphone, heroin, fentanyl. They're great medications post-operatively and if you have acute pain, but they over time lead to dependence and they can lead to patterns of abuse. Most people have no problem stopping. If they get an appropriate prescription, it's given for the appropriate reason, which is normally pain, and it's not prescribed over a long period of time. What can happen if you become physically dependent on them? When you have an abrupt stopping of the medication, you can get physically very sick. It's like the worst flu you ever had with the worst anxiety you've ever had. It can also lead to problem behaviors, like sometimes people may start out post-operatively with medication and they develop an issue with it, and then when they no longer can get it, like a medication prescribed, they would go to a street medication, and those illicit opioids are often unsafe. We don't know what's in them, and they can be quite dangerous. The withdrawal syndrome is pretty evident, and you can get a runny nose, you get goosebumps, you get nauseous, you can get diarrhea, you get really agitated. So the withdrawal is when you stop taking them abruptly, and that can happen even if people are on opioid medications post-operatively from a prescription, and they may not be taking more than they should. They may be taking it as prescribed, but because it does cause physical dependence, when you're on it chronically, you can still get sick. It doesn't mean that you have substance use disorder, but you've developed tolerance and then have withdrawal symptoms when you stop, and it can be quite surprising how quickly you can run into that issue. In terms of how do you know if someone's abusing any substance or opioids, if they have a prescription for opioids, they may be getting it filled or asking for early refills. They're running out of it very quickly, so maybe they're getting 2 or 4 weeks of medication at a time and they're back in 4 or 5 days. Wanting a prescription refill. So sometimes the pharmacists are the first people to actually see this happening. People can get really fixated on needing to get opioids. They think about it all the time. They will do many risky behaviors to get opioids, which becomes very problematic from a personal and public safety perspective. If someone uses too much, if they overuse opioids acutely, they can overdose. So, what does that look like? Can look like a decreased level of consciousness, their breathing slows down, they can't stay awake. People use them orally, they may use them intranasally or snort them, and they may inject them. So obviously there's a lot of risk when people start to inject opioids. There's a risk of infection. They can be significant, and that can lead to increased use of healthcare resources, being admitted to hospital, needing IV antibiotics. There can be an increased risk of bloodborne pathogens, especially if you're sharing paraphernalia. Often chronic opioid use can lead to issues with people's mental health, whether that's due to overuse of opioids. Maybe you get financial problems, you have problems with relationships with your family, with your significant other, with friends. You can become more isolated. We see issues with people's moods. That being said, people sometimes use opioids to manage chronic underlying mental health issues that need to be addressed for people to help support people to stop using opioids. The first thing to do is have that conversation that you're there for them to support them, to encourage them to reach out for treatment. Opioid use disorder has, some really excellent treatments, some very effective medications that are widely available in New Brunswick. It's a big deal to step forward and admit you have an issue, to come into a clinic where you're worried you're going to be judged and there's going to be a lot of stigma, and so just to be supportive. You can go to the Horizon website and search for mental health and addictions, and there are some regional contact numbers you can call for more information. Here in Fredericton, we take walk-ins and get your information. You can also talk to a healthcare provider to get a referral or to get more guidance as to what's available in your community.